We have exclusive new insights tonight into the prescription drug-related deaths we've been seeing lately. The chief medical examiner of Nova Scotia believes prescription drugs are killing a significant number of people by accident, and they're usually not drugs prescribed for their medical conditions. He is sharing his insights tonight with CTV's Jacqueline Foster.
There are more males than females in that group.
The chief medical examiner is talking about prescription drug-related deaths. 437 people in Nova Scotia between 2007 and 2012. Dr. Matthew Bowes says of those deaths, up to 40% are suicides, the others accidental.
There certainly is a cluster of deaths in the 20s, but there's a much bigger peak actually in the 40s.
What is more difficult to determine is where the drugs came from.
People are not typically dying of the drugs that were prescribed to them for medical conditions. I would say that typically they are dying of prescription drugs that are bought from other illicit sources.
Dr. Bowes points to a study he did for the Department of Health.
It is very clear that when you look across sort of 12, 15 years of data, that the number of prescription drug overdose deaths has gone up. And I think it's roughly doubled over that time period.
Things are not changing fast enough.
Amy Greaves lost her brother Josh to prescription drugs in March 2011. The 21-year-old died after mixing alcohol and Dilaudid at a party.
I think we're doing better in terms of awareness and people, especially professionals, acknowledging that there is a problem.
Certain pockets of individuals that are willing to sell, trade, buy prescription drugs.
The issue being acknowledged during a maritime police panel on CTV News with Steve Murphy last night.
I have found this so startling.
And Nova Scotia's health minister is promising prescription drug education will be added to school curriculum starting at the middle level next September. The health minister says a drug information system is also being rolled out across the province to strengthen the prescription drug monitoring program. It's expected to be in place in a little more than a year.
So that we can again be vigilant on those that try to double doctor.
Amy Graves says collecting data is good, but it's what you do with it that's most important.
We've only scratched the surface.
So for now, she does what she can to raise awareness about this prescription drug problem. Jacqueline Foster, CTV News, Halifax.